So good afternoon to everyone, and welcome to the webinar entitled Family Advocacy for Residents During COVID. I'm Robin Grant, Director of Public Policy and Advocacy with the National Consumer Voice for Quality Long-Term Care, known as Consumer Voice for short. I want to say that this is a landmark occasion for us because it's the very first time that we've streamed a webinar on Facebook Live. So we're delighted that those of you on Facebook have joined us today. So welcome. As you can tell from the title, this webinar is designed for family members, although of course we're delighted to have every single one of you with us today. But our decision to conduct a webinar with family members as the target audience came about because at Consumer Voice, we're being contacted almost daily by family members who are really struggling with how to best support and care for their loved ones in long-term care facilities during this COVID-19 pandemic. So the goal of today's webinar is to provide information directly to families to help them in advocating for their loved ones and in addressing some of the issues that we have noticed are arising. So here's what we're going to cover today. Next slide, please. We'll start by providing some strategies and tips for family advocacy, both as an individual family member and through a family council. And then also talk about how the long-term care ombudsman program can help advocate on behalf of residents. Then we'll look at some of the particular situations that families are confronting and try to equip you with knowledge and strategies to assist you in figuring out how to navigate your way through in a way that works for you and your loved one. And lastly, we'll touch on how joining with others to advocate at both the state and national levels, again, can help you and help residents. Then we'll spend any time that remains on questions and discussion. And I do want to say I am going to be sort of speaking directly to family members. So when I say you, that's who I'm addressing. And of course, this also we hope will be helpful to the rest of you as well. So we have 4 speakers today. From Consumer Voice, our presenters are Jocelyn Bogdan, Program and Policy Specialist, Sam Brooks, Program Manager, and me. And from, I guess the expression is the great state of Texas, we're so pleased to have Patty Ducaille, who is the Texas State Long-Term Care Ombudsman. So before we begin, I want to cover just a few housekeeping details. Today's webinar is being recorded. The slides can be downloaded from the chat box. There should be a link in there that you can click on. The recording and the slides will be emailed out to all of you early next week and posted also on the Consumer Voice website. If you want to ask questions as we go through the presentations, feel free to put your question into the Q&A box that's on your control panel, and we'd ask that you reserve the chat box for making comments and discussion among yourselves throughout the program. Finally, all lines are muted throughout the webinar. So, one last thing. Because we're hoping to reach a lot of family members through this webinar today, we thought we'd do a quick poll to see how well we did. So, I guess, Tina, could you please launch the poll? So unfortunately, those of you who are viewing this on Facebook can't take the poll, but the slide does show you the questions. Okay, so hopefully everybody has taken the poll. Give you just a couple more seconds. Okay, Tina, could you take down the poll and show us the results? Okay, so let's see, 14% are family members from of a nursing home resident or assisted living facility. Um, okay, resident of a nursing home. Looks like we have a lot of ombudsmen today, so that is fabulous. And a number of others as well. So we certainly do have some family members on here, in fact, a fair number. So we're delighted, that's great. And many other advocates, and we know that those of you, and I know particularly ombudsmen, will be taking this information and sharing it with the family members that you work with. So it's all good. So thank you. Next slide, please. Okay, since the COVID crisis began, I think for all of us has really felt like in many ways the world has just turned upside down, and everything feels different. On the one hand, numerous aspects of nursing home life really are different and have changed since the COVID crisis began. But at the same time, it's really important to recognize that there are many things that have not changed, including important residents' rights and protections that did not go away with COVID. So on this slide, you can see what some of these rights are, and you can see that the facility is still required to provide all the care and services your loved one needs to reach his or her highest level of well-being, and that is regardless of the pandemic. That requirement is absolutely still in place. But we do know that advocating for person-centered quality care for nursing home residents right now really can be challenging. And that's why we want to equip you with knowledge and suggestions for how you can do this advocacy in a variety of ways. And Jocelyn will start by discussing how you as an individual family member can advocate for your loved one. So Jocelyn, I'm going to turn it over to you.
Thank you. Next slide, please. So I'm going to talk a little bit about individual advocacy, what you as an individual can do to help your family member during this time. To start, I know this is an incredibly frustrating time. I've spent a lot of time over the past few months talking to family members who have loved ones in long-term care facilities. And the first thing to know is you're not alone. You have valid worries and concerns, and we're going to discuss some of these issues that many people are facing in a few minutes. But a lot of people are wondering what they can do to help their mom or dad or son or daughter who's in a nursing home or assisted living right now. It's not as easy as when you could easily visit and keep an eye on things. And it's not as easy as when ombudsmen and surveyors were regularly inside of facilities. Things are a lot harder now, but that doesn't mean you can't still advocate for your loved one. You can, and you should. There are several different things you can do. Next slide. We're encouraging people to do what they can to work with their loved one's facility. Right now, facilities have quite a bit of discretion in a lot of different areas, and the more you communicate with them, the better. Speak regularly with administration and staff. You can ask them for updates. You can ask them to call you and tell you what's going on with your loved one. If you have a concern, call the facility. They may not always answer, and you may have to call back, but go ahead and call them back. Ask them what they're doing to keep residents safe. As we'll discuss later, facilities are required to tell family members how they're mitigating the risk of COVID. So if they're not offering this up, ask them. Ask what their policies are. Ask if they have enough staff and PPE. Ask if they're making sensible, cautious decisions, like letting residents keep their doors open and go outside when there's no COVID in the facility. Ask what activities they have planned for the day. Ask if your loved one is bathing regularly and if they're eating. Ask them to share this information with you. And go further, insist that they regularly update you and all family members. There's certain information that we'll discuss that facilities are required to give you on a regular basis, but don't be afraid to ask them for more. Ask them to send out weekly emails to families letting you know what's happening in the facility, what socially distant activities are going on, what residents are doing to keep busy, what else is happening. If you have a concern, ask for a care planning conference where you can bring up the concern and work with the facility to brainstorm ideas, discuss issues, and come up with mutually agreed upon solutions. And this was listed on an earlier slide, file a grievance. If there's a problem, your loved one still has rights. They can still file a grievance with the facility and they have the right to have it addressed. All of that said, sometimes working with the facility isn't going to be enough. Sometimes the facility's behavior is too egregious, or even if it's not, they might just not answer their phones or return their calls. They're busy right now. Next slide. Even though ombudsmen aren't allowed into facilities right now, they're still working hard and helping family members and residents. And we're going to have a wonderful state ombudsman speak more about the ombudsman program in a few minutes. But if you're having problems with your facility, contact your long-term care ombudsman program. They're there to help you advocate. We're also encouraging people to file complaints with your state survey agency. You may have heard that during COVID, the scope of inspections has been limited, and that's true. But that doesn't mean you shouldn't still document your issue and file your complaint. You should. I've talked to several family members who have done all of these things. They've talked to the facility. They're working with their ombudsman. They filed complaints, and they still aren't seeing the change they need. In a moment, Robin is going to speak about the importance of using family councils, but we do have a few other suggestions we want to emphasize first. Think big. Contact your elected officials, both your local state representatives and your congressional representatives. Your legislators need to know what's happening in their state and district. You can reach out to constituent services, but you can also just email and call their offices. If the situation is unacceptable in a facility, they need to know that. Your family member is their constituent. Something else you can do is reach out to the media, from writing a letter to the editor to calling your local news station to tell them what's happening inside the facility. You can also use social media to call out a facility. Facebook, Twitter, tag them and tag the local media in posts. Hold the facility accountable. Next slide. We also want to encourage family members to help us advocate at Consumer Voice. Something we're now asking families to do is to share your story with us. As you can see, we have a special link on our website, listed right here on the slide, to share your story. We've heard from a lot of families who are really struggling to help their loved ones right now, who are very worried about conditions inside of facilities. Families maybe like yours that are deeply concerned with what they're seeing and hearing when they video chat with their loved ones. We're asking families to share these stories directly with us via this link so we can use them to inform our advocacy. Without eyes in the facility, stories from family members are some of the most important advocacy tools we have when we talk to CMS and when we talk to legislators. Your stories and experiences are valuable, so please share them. Advocating on your own can be powerful, but sometimes it's even more impactful when you work with other families. And with that, I'm going to turn it over to Robin to talk about family councils.
Thanks, Jocelyn. So a family council can be a very effective way to address concerns that apply not just to one resident, but to most or all residents in the facility. Next slide, please. So some of you may be very familiar with family councils, but for those of you who aren't, we want to make sure that you learn what they are. A family council is a group of families and can also be friends of nursing home residents that is led by the family and not the facility. And this is a group that then comes together to work to improve the quality of care and quality of life for all the residents in the facility. And it's also a way to give family members a voice in decisions that are being made at the facility that affect them and also that affect their loved ones. And it's kind of a cross, I think, between a PTO and a union. Not exactly, but along those lines. So the idea here is that there's both strength and safety in numbers. Next slide, please. There's a whole host of things that family councils can do, and you can see on the slide just some of the many things that they can take on. But right now, for the purposes of this webinar, I really want to focus on the family council's problem-solving role, because that is really one of the major purposes of a council. to come together and to give families the opportunity as a group to discuss among themselves, concerns and complaints that they have about their loved one's care, treatment, or in fact, any issue that's related to the resident's stay in the facility. So that could also include policies and the way the facility is operating. So once an issue has been raised, family council members then agree together on whether they want to move forward with that issue and they want to address it. And then if they all agree, the council takes those concerns to the administrator. And the facility is then required to act upon those grievances and respond to those concerns. I'll say just a little more about that in a minute. Next slide, please. Family councils are actually so important that they are given certain rights under federal regulation. And in a number of states, there are even laws that give family councils additional rights. So that's something that you'll want to check on in your own state. So this slide lists many of the rights of a family council. And you'll see it doesn't actually use the regs don't use the word council, they refer to a group, but that what is meant there is a family council. So you can see that family members have to be given a private space to meet, and that the facility can't just ignore the concerns of the council. You can see in the last bullet point, it says the facility must listen to the views and act upon the grievances and recommendations of residents and families. So it not only must respond, but it has to, as you can see here, demonstrate its response and the reason for its response. The regulation also is very clear that it doesn't mean the facility has to do everything that the family council asks, but it does have to be able to explain, why it hasn't and what it has done. So these rights are very important for family councils. They really help shore it up. And one point I do want to point out is that facilities actually are not required to have a family council, but they absolutely are required to permit one to exist. So that means that any family member has the right to start a council if they wish. In general, we've seen that councils tend to meet on an ongoing basis. They meet maybe once a month, and that's something that's determined by each council. And they usually meet in person in the facility. So under COVID, the world's different. The council could meet outside the facility. But if you want to involve family members who live far away, the best way to meet is through phone conference calls or through our new best friend, Zoom. Next slide, please. So if you're hearing about family councils for the very first time today and are interested, what can you do? First of all, find out if there already is a family council at your loved one's facility. Sometimes it is not very well known whether a council exists. So find out. You can ask the administrator, you can ask the social worker. And if you find out there is one, get the name and the contact information for the family council president and then reach out to that person to learn more or to actually join. And if there isn't a council, start one. As I said, any family member can start a council. All it takes is one family member to get the process started. So you will be starting, if you're creating one during COVID, you'll be starting pretty much a virtual council, which would, as I said, meet by phone or through video conferencing. But the question is, and the challenge is, how do you reach other family members? So in a pre-COVID world, you could have done that while visiting your loved one in the facility. You often see other family members and talk with them, and so you can get the word out that way. But the major hurdle now is that you can't go into the facility. So you need to be creative and find other ways to connect with families. The good news is that there are other ways. So we'd recommend that you start by developing a flyer that announces that a council is being formed, puts your name and contact information on it. And on our website, we do have sample flyers that you could use and tweak. You'll want to inform the administrator that you're forming a family council. It's a really good thing if you can get off on the right footing. Present the idea in a positive way, that there are lots of benefits of a family council, not only to residents and to families, but also to the facility itself. And so if you get that buy-in from the administrator, you could ask for the administrator's assistance with sending your flyer out to family members. The facility is not able for privacy reasons, to give you the names and the contact information of all the family members, but they can send the flyer out to those individuals. If the administrator is resistant or won't help, you can contact the Long-Term Care Ombudsman Program for guidance and maybe even some assistance in persuading the administrator. An additional way that some ombudsmen may be able to help is by sending your flyer to family members who are at that facility. So a number of ombudsmen, and this varies from state to state, but a number have been able to obtain the names and contact information for residents' family. And so they could be in a position to get information out to them. So that's an approach you can try. We've heard about forming family councils through Facebook. So you could create a Facebook group. One family member did that. She called it Families with Loved Ones at ABC Facility. And that can attract family members who join that Facebook group. And then you can start communicating with each other and talk about discussing or talk about forming a family council and then go from there. And then finally, be creative. And I want to give a big cheer for the family member we heard about who was very assertive. And she stood outside her loved one's facility at the location where family members can pick up and drop off residents' laundry. She stood there and she handed out flyers as family members came by to pick up or get their laundry or drop it off. And so at the same time that she gave these flyers out, she also asked the family members to give her their contact information, and then she was off and running. So it does require a little more effort and some innovation, but it is absolutely possible to form family councils during COVID. Next slide, please. So once you've started the council, you want to do whatever you can to make it strong and effective. And there are lots of resources out there to help you do that. First of all, part of the job of long-term care ombudsman is to help promote the development of family councils. So you could certainly turn to the ombudsman for guidance and for materials. And secondly, consumer voice. We have a family council center actually on our website that has a wealth of materials related to starting councils, maintaining councils, what do you do if you run into problems with the facility, and on and on. So I really encourage you to get more information and use that to help you build the council. We have seen for quite some time now that strong, effective councils that are really led by family members can really bring about change in a nursing home. So in this time of COVID, there can easily be a number of kind of systemic issues that are impacting every resident that a council may want to address. So for example, we're hearing about facilities with kind of blanket policies, one size fits all. And for example, one of them is requiring all residents to stay in their rooms with the door shut. And that's being applied to all residents, even if it's having a detrimental impact on the residents' well-being. That is a perfect issue for the family council to take up and to talk to the facility about changing that policy, individualizing it. Another issue that we're seeing right now is the council could advocate for the facility to share information with family members about the number of cases, about the number of deaths, about their supply of personal protective equipment and staff shortages. This is information that facilities don't have to provide to family members, but they certainly can. And it's certainly information that absolutely most family members would want. So that is another issue that is perfect for a family council to take up. And there are many more issues like that during COVID that would be great for family councils to advocate around. In general, family councils really can be successful. They can improve the quality of life and the quality of care for residents. And I think that they're more important now than ever. So we hope that you will certainly consider that as a way to advocate during this time. So now I'm going to turn things over to Patty. You have heard me and also Jocelyn talking repeatedly about the long-term care ombudsman program. So Patty, tell us more.
Hi, I'm Patty Ducaille, and yes, the Texas State Long-Term Care Ombudsman. Thanks for allowing me to be with you today. I'm really pleased at the turnout and glad to have you all here listening. The State Long-Term Care Ombudsman program is mandated by federal and state laws, and those laws give us access to the facilities and to private interactions with residents, and they set our requirements as a long-term care ombudsman program. The laws establish that every state must have a state long-term care ombudsman. That's my role. And the territories of Guam and Puerto Rico and the District of Columbia also have a state ombudsman and a state long-term care ombudsman program. We are representatives of the interests of residents, and that's nursing facility residents and what I'd say is assisted living facility residents. Your state might call assisted living something else, maybe board and care homes, adult family care homes, or foster care, or adult residential care. A long-term care ombudsman's role has really two levels. There is this function we perform as a public advocate for all residents and speaking up for the needs of residents in long-term care facilities. And then the other role is this solving of problems for one resident or a few residents in a facility. And both of these functions are really dependent on one another. Usually we get complaints when we're in a facility. We're talking with and seeing residents face to face. An ombudsman goes door to door and knocks before we enter a resident's room or their space. We look around the physical building, looking and listening and smelling. We observe the operations of the facility, like how staff greet us, how staff treat residents, how they communicate with one another and provide care to residents, whether staff take their time or rush. We work to build effective relationships with staff so that when we bring them a problem, there's this foundation of respect and rapport that we've established with the facility staff, and hopes that that makes our problem solving more effective and perhaps easier. We do get complaints from anyone. That means family members, medical personnel that don't work for the facility, also facility employees and legal guardians, and ombudsmen actually bring a lot of complaints ourselves to the attention of management. There are essentially two factors as to whether an ombudsman can work a complaint, and that is, does the complaint relate directly to the care and services of a resident? And if the resident's able to consent to our help, we have to take direction from the resident. So sometimes that means that a problem that we may not see, that we may see as a problem, isn't a problem to the residents. And it's important for us to recognize and respect that. So I just have a second slide, if we could turn to that one next. Thanks. So just to dive in a little bit more on the kinds of this different work, either an individual problem solving and systemic problem solving with you, I should recognize and say that COVID-19 has shifted the Ombudsman program. Our operations that were mostly in the facility and at the bedside with residents are now shifted to phones, email, video communications. And so it's not really always possible for us to interview residents and staff, look at medical records, or observe the environment like we normally would when we're investigating a complaint. COVID-19 has really disrupted us temporarily as well. But we are taking calls, emails, and mailed complaints. We are working complaints through those channels. And we're using our networks to get information and share it with you and residents, to get policy interpretations, and to still resolve complaints. We are speaking with facility management, of course, by phone and email. We're talking to the corporate level management and provider associations that many facilities are members of. We will and have coordinated with law enforcement like state attorneys general, Medicaid fraud unit, the inspectors general, court systems, and sometimes the police. So there is an opportunity for us to work with a lot of different agencies to resolve problems or just to get information. It's really important to tell you that ombudsmen are using our knowledge and powers of persuasion, but we don't have enforcement authority over a facility. And this is how the program was designed. It makes us different from other services like the state survey agency that regulates facilities. And while I recognize it's a limitation, it is also a strength because it gives us a lot of flexibility and we can really advocate to almost anyone about a problem that affects residents. But with that flexibility, we also have to work to persuade. We have to be honest. We need to be factual, and we work to be really thorough. And so that's why when we are collecting information about a problem that you might bring to us, we may have a lot of questions for you so that we can understand the problem and communicate it as best as possible. So to work with an ombudsman, I will start by saying, as the state ombudsman for the last 14 years, these days I don't work very frequently on individual complaints with a resident. I spend most of my time managing staff, helping them with their complaints, supporting them, researching, making sure that ombudsmen follow our procedures, and working on federal or state policy changes. But COVID-19 has really disrupted that, and in this way, in a very positive way for me, because I have never had so many family members reaching out to me personally as I have in these last 3 months. I am hearing anger and hurt and worry, and it's tough to listen to, but it is this sense of this energy and this momentum that I can feel, and I think it's why you're on this webinar today. I really think that if you can keep this momentum going, we can make a bigger difference and have a bigger impact on the quality of care in these facilities. When you want to work with an ombudsman on an individual problem, you can expect a few things from us. First, that we are going to focus on what the resident wants, and that includes a resident with dementia. That we are going to focus on confidentiality, and you can trust in us that you might get asked a lot of questions like, do you consent to me doing this, or do you agree to me taking this step? We're going to be checking with you to ensure that if we're using your name and have permission to do so, that we know and are confident that you're comfortable with that. And if not, we will work on your complaint as an anonymous one. You can count on an ombudsman for advice based on our experience with the facility or the owner, or with similar experiences in another facility. We're going to give you the best advice we can offer. You can expect that we'll have group thinking and planning, that the ombudsman will be asking other ombudsmen about how we can solve a problem, but we'll maintain your confidentiality as we do that. And finally, I will jump to systems advocacy because I realize I am at my time or nearing it. And I want to say just that a couple of things that Jocelyn mentioned before, that we are working with these four major entities, the media, lawmakers, state survey agencies, and national organizations, and that it is so important to engage with these right now, especially under the restrictions of visitation. With the media, if you read an article you like, write to a reporter and thank them. Let them know you have a story to tell. Ask your state ombudsman if there's a reporter that they would recommend you reach out to, or work with your ombudsman about preparing a story and bringing it to a good reporter that you find. And use your social networks for your stories. Very important. And the only other item I'm going to talk about here because of time is to mention lawmakers. In Texas, we only have a legislative session every other year for about a half a year. So it's an important time to be getting ready for that session next year. Right now, while it's fresh and you are energized, write down your experiences, write down a story for yourself, and think about something you would recommend to improve care or make a change. Recognize a problem that we faced here and have an idea about how to solve it that you can pitch to one of your lawmakers, and work with the ombudsman on this. We'd really like to work with you. We've done so in the past with legislators, and a family member giving testimony can be so powerful. So I will leave it there and turn back to Jocelyn, I think. Thank you so much for this time with you. I'll be back for questions and answers.
Thanks, Patty. That's such incredibly helpful information for everyone. As we mentioned at the beginning, we speak with a lot of family members at Consumer Voice. And during COVID, we've been hearing from families who are really struggling with a variety of different issues. We want to use this next part of the webinar to discuss some of the situations that residents and family members are confronting during this time and help walk you through some of the scenarios you may find yourself in. Robin, Sam, and I are going to discuss these different situations, but we're also going to bring Patty back in for some of them so that you can get the perspective of an ombudsman and see how they may be able to help you if you find yourself confronting these issues. We're going to discuss visitation, transfer discharges, going outside and leaving the facility, transparency, and testing. And with that, I'm going to turn it over to Robin to get us started and discuss visitation.
Thank you, Jocelyn. So let's take a situation that we hear about a lot at Consumer Voice. Here it is. You haven't been able to visit your loved one in person for 90 days, and you can tell that she's becoming more confused and her mental condition is deteriorating. We know that one of the most distressing situations that family members have had to face for these many months now is that they have not been permitted to visit their loved ones. It is an agonizing situation. This goes back to when in March, CMS issued guidance in consultation with the Centers for Disease Control and Prevention that took the absolutely unprecedented action of barring access to all visitors, and that included families. It included what CMS calls non-essential healthcare personnel, and it also included the long-term care ombudsman. So what you're seeing is the actual guidance that facilities are using and that everybody is referencing. So you can see that the only exception for visitation is under what CMS has called compassionate care situations. And in the guidance, CMS cites end-of-life care as an example of what a compassionate care situation might be. And it also goes on to say that these decisions about visitation during an end-of-life situation should be made on a case-by-case basis. Unfortunately, we're hearing that many facilities are defining compassionate care situations in a ridiculously narrow way. For instance, families are being told that they can only see their loved one when she or he is actively dying, whatever that means. Or they're being told they can only have a one-time visit during the dying process. Then facilities are also considering compassionate care situations only to be for end-of-life situations, even though you can see from the guidance itself, it's clear that that is only an example. It says such as an end-of-life situation, implying and meaning that that is not the only situation that would be considered a compassionate care situation. Next slide. So that guidance generated a lot of questions, understandably. And so at the end of April, CMS issued a document called Frequently Asked Questions. And they put this question in: what is an example of a compassionate care situation? In red and bold, you'll see their response. One example of such a situation is one in which a resident is receiving hospice care and their health status is sharply declining, or when a resident is not enrolled in hospice, but their health status has sharply declined. Unfortunately, this really hasn't cleared things up, and compassionate care just continues to be interpreted very, very narrowly, and almost always just when a resident is dying. So visitation has just been a huge problem. I have to say we're seeing some creative strategies for connecting residents and families when they can't actually physically visit. We've seen, window visits, and who knew that was going to become a thing, and message boards where residents write a message to their loved one and staff take a picture and send it to their family members. I mean, these are creative ways, and that's great. But they are not in any way, shape, or form the same as an in-person visit. And we are hearing from residents themselves, from family members like you, and long-term care ombudsmen, that the pandemic has taken a really terrible toll, not just on the physical health of residents, but on their emotional health as well. And we're hearing that residents feel abandoned. They can't understand why their loved ones aren't coming to see them anymore. They feel lonely, despairing. Residents with dementia are losing the direct connection with the people who anchor them and ground them, and they're declining cognitively. Other residents seem to be giving up, have stopped eating, lost a great deal of weight, and are steadily declining. And I will never forget, there's one state ombudsman who really put it starkly. I mean, she said that residents are literally dying from isolation. So what can you do with this situation? Next slide, please. What can you do to visit in this situation where your mother is becoming more confused and her mental condition is deteriorating? First of all, as an individual family member, make the case to the facility that your loved one fits the definition of compassionate care, and that you should be permitted to visit with your loved one. I suggest that you provide details about the ways in which you have observed that your mother, in this case, is declining, and use that as evidence to support the case that you're making. So that's individually, but let's turn again to the family council. Could take this issue to the family council, where the council together as a group can advocate for the facility to expand its general overall interpretation of compassionate care. So that it includes residents with dementia whose condition is deteriorating. So it includes residents who are suffering physically because they used to get help from family members and no longer are. Push push for this definition to be broadened so that every family member whose loved one is in that situation can visit. And also work with the family council to develop a phased-in approach. Advocate to the facility that what is needed is opening up visitation in a way that is sensible, that is cautious, and encourage and work with the facility to create policies that include input from residents and family members. And then another strategy could be on your own and with the family council. Advocate for the state as a whole to develop a plan that permits visits in a gradual, fair, common sense way. We're seeing now across the country, many states are starting to release their plans for opening up visitation. So find out where your state is and how you can advocate for a plan that allows visits in a thoughtful, sensible, smart way. So I just want to stop for a moment and ask Patty if you have anything you would add from an ombudsman perspective related to visitation, maybe what how an ombudsman might help a family member.
Sure. Honestly, everything you've said is what an ombudsman will do and help a family member attempt. What you can expect from an ombudsman is also that they should know the state rules really well that apply. So if there is some partial reopening to visitation, which is starting to happen around the country, your ombudsman should be informed about that and can do some research. And there may be different perspectives in each state about what compassionate care visits may mean. I know I'm doing some advocacy on that front in our state to try and broaden that definition as the visitation restrictions are continuing for some time here. So knowing what those policies are is important at the state level, and then also an ombudsman can help you interpret what the facility's policies are. They need to tell you what their rules are, what's allowed, and what you should expect to need to follow in terms of any kind of infection control measures. And an ombudsman can help you navigate that. Finally, I guess I'd say if you do have a visit that doesn't go well for any reason, of course you should talk to the facility point person about what happened, but an ombudsman might be a really good resource to work through what happened, and they may help you communicate with the facility before your next visit.
Thank you, Patty. That's extremely helpful and really good to know that ombudsmen are there to provide support and guidance and assistance. Next slide, please. So the next situation we want to look at involves transfers and discharges. So the scenario we're going to lay out for you is that your mother has just called you from her nursing home crying and extremely distressed, saying she's being moved right now to XYZ facility. So the facility where she currently is can be turned into a place just for residents with COVID. So the first thing to know is that under existing federal nursing home regulations, there are many protections for residents related to transfer and discharge. Two of those protections you see on the slide, and that's when a facility proposes to transfer or discharge a resident has to be given advance notice, and that's generally 30 days. And the resident also has the right to challenge the proposed transfer or discharge, and they can do that by appealing. However, during the pandemic, one of the recommendations from the CDC is that residents with the virus should be separated from those who don't have the virus, either in a separate dedicated part of the facility or in a facility that's COVID only. And this is a practice that is called cohorting. And in order to make it easier for facilities to cohort, the federal government has waived the regulations that you see here that have to do with transfers or discharges that are related to COVID and cohorting. So I just want to stress that these regulations are being waived only in situations where COVID is involved. There are lots of other reasons that we see transfers or discharges being proposed. And in those situations, the full set of regulations applies. So that's really important to realize. Next slide, please. So the right to advance notice is waived in only 3 situations, again, that are COVID related. So the 3 situations are the ones you see here: when residents with COVID, or I would add a respiratory infection symptoms as well, when they're transferred to a COVID-only facility. Second situation, when residents who don't have a COVID diagnosis or symptoms are transferred to a non-COVID facility. And then the third is when residents, their status is unknown, but they don't have symptoms of COVID, and then they are transferred to another facility for a 14-day observation period. Next slide, please. So in these 3 situations, and again, only these 3 situations, CMS has directed facilities to provide notice as soon as practicable. In reality, what that boils down to is that residents can be moved incredibly abruptly. They can be notified as the move is happening, and family members may not be notified until after the transfer has happened. This is a situation that we are really concerned about and have certainly been doing advocacy around. And I'll say a little more about that in just a moment. So in the scenario that we just described, your mother is being transferred to a non-COVID facility, obviously without any advance notice. So what can you do as a family member? I have to say that unfortunately the options for immediate action are not great, but I'm going to share some thoughts. Next slide, please. First of all, it's important to know that the resident still has certain rights and protections related to transfer and discharge, even in these situations. And 2 of those are that the resident has a choice of where he or she is transferred, and also has the right to be prepared and oriented to that transfer and discharge, so it's as safe as possible and minimize transfer trauma. Next slide. So as an individual, you could call the facility. There's no guarantee with any of this, but you have nothing to lose. Insist the transfer be stopped, at least momentarily and temporarily, and ask for a meeting for you and your loved one to discuss alternatives to this move. And that would be with the administrator, staff, the ombudsman if possible. And if you have a doctor for your loved one, that's somebody who really would speak up for what's best for your loved one and not just what's best for the facility, it would be good to have that the doctor participate as well. And then you can talk about some possible options. Could your loved one stay in the facility? Now, that's a risk that you'd be taking on if your resident, your loved one doesn't have COVID and is staying in a COVID-only facility. This is a stretch. It's highly unlikely that you'd be successful, but it's also kind of questionable whether it's even a good idea. But it is some things that some people might want, to explore. A second option might be whether your loved one could, come back home or could transfer, somehow transition back into the community. And a third option might be to explore whether there's another nursing home where your loved one would rather go. Because not by coincidence, we have noted that often the facility where the residents are being sent just happens to be owned and operated by the same owner. So it's a sister facility under the same corporation. But your resident does not have to go there. He has choices. And one last option, which might at least buy you some time, could be to agree to the move, but then kind of push for a delay so that your loved one can be prepared and oriented. Because we know that that can help mitigate at least a bit the devastating effects that can happen when somebody is transferred. This is a difficult situation, no doubt about it. The ombudsman might be able to help you, but I want to be really honest. There's not a lot of recourse here. We're in a public health emergency. To be honest, no one at the state survey agency is probably going to back you, and you can't appeal. So it's tough, tough, tough. So I think the best course of action for all of us actually is to advocate for more humane COVID-related transfers in general for all facilities, so that what happened in this particular scenario is not repeated. So this is something that individual family members and the family council, you can advocate for this at the facility level and at the state level. There's really no reason that a facility can't give some kind of advance notice, even if the requirement is waived, and have a discussion beforehand to explore options. So that is in fact what we at Consumer Voice and other advocacy organizations are pushing for nationally. I just want to ask Patty if there's anything briefly that you would like to add to this. I know this is a huge issue. Not fair to set you up for something so brief.
Thanks. Again, this is Patty, and our best option here is if the state has taken a role in leading on this front, and a state can have demanded that its facilities do certain things in order to be a COVID receiving facility. And that will probably largely influence the experience that a resident and the family members are going to have here. I will emphasize that an ombudsman can certainly demand that residents or their legal decision makers are given choice, certainly about where they move to, but also the choice to stay. And we have had some residents who've decided to do that in our state. In fact, in one facility that was planning to become a COVID-only facility, no one was willing to move, and it influenced the facility so much that they did not become a COVID receiving facility. So that was a power in numbers action in one place where everyone stood together and said no, and it influenced the owner's decision. And so there could be a very powerful message there if you organized. The other thing I would say that we focused on is for those residents that are being moved out in these circumstances, we have harassed the owner that they have to give assurances that everyone can come back after the crisis if they want to. And we have gotten that assurance in writing to protect residents' right to return. We've also gotten assurances in writing that all the residents' belongings will go with them wherever they go, that things will be sanitized and protected for the residents, so that we ensure as good a move, as you said, as good a move as possible under these circumstances. I'll leave it there.
Thank you, Patty. Boy, that is really, that's inspiring to hear that when all the residents sort of stood together, it made a difference. So that was really helpful to know. We're going to move on now and talk about some additional common situations. And I do want to say that I neglected to tell you at the beginning that the webinar does go till 3:15. So I hope that many of you can stay with us right to the end. So now I'm going to turn things back over to Jocelyn to talk about another situation.
Thanks, Robin. Okay, so we're going to talk about leaving a facility during COVID-19. And we're going to address 3 different scenarios. First, going outside within the facility on a porch or a shared courtyard, but staying on the facility's grounds. Then we'll talk about going out for a walk down the street, or what would happen if you as a family member decided to take your mom, a resident, out to lunch. And finally, leaving the facility for the duration of the pandemic. Next slide, please. So to start, let's say that your mother's in a nursing home and she wants to get some fresh air in the nursing home's shared courtyard. First of all, there's no CMS guidance that says she can't. There's an FAQ that CMS released that you can see on the screen that asks about leaving a facility for an outside activity, and the only answer they give is that outdoor group activities should be canceled. That's it. Next slide. So yes, going outside on facility grounds should be permitted. There are facilities that are starting outdoor visitation. There are facilities that have been allowing smokers to go outside. As long as residents practice social distancing when they're moving around the facility and outdoors, such as wearing a mask and staying 6 feet apart, residents should be allowed to enjoy the facility's outdoor spaces. Remember, the nursing home is your loved one's home. Residents should be able to enjoy their homes just like other people do. Outdoor recreation is encouraged right now, and there's no reason that that should be different for residents in long-term care facilities. I do want to add that this might be a little bit different if the facility is experiencing a COVID outbreak, or if your loved one is in a COVID positive facility. Then there's CDC guidance, and the facility may want to keep people in their rooms for their safety. But if there aren't many cases, or if the outbreak is isolated to a different part of the facility, you should still advocate for your loved one to be able to go outside. But what if the facility says no? We've heard of facilities, and Robin referenced this earlier, where there are no known cases of COVID, and they're still not allowing people outdoors. They're also not even allowing residents to open the doors to their own room. Next slide. So what can you do? You can talk to the facility, ask for a care planning meeting and bring up this issue. And if you need help, get your ombudsman involved. And we have an ombudsman right here who can weigh in, but I'm going to go over the next scenario first to save a little time. Next slide, please. Okay, so this scenario gets a bit trickier. What if your mother wants to go for a walk away from the facility, or if she wants to go out to lunch at a nearby restaurant? As states reopen and families can't visit their loved ones in the facilities they're in, there are going to be families who start asking if instead of entering the facility, they could take their loved one out to lunch the way they used to before COVID. So there is a CMS FAQ that asks what facilities should do if residents want to leave their nursing home against medical advice. Facilities cannot detain your loved one. If your mom wants to leave, she can. However, there will probably be repercussions from this, and we want family members to be aware of that. The FAQ notes that facilities should emphasize social distancing, but that if the resident intends to return, the resident should be monitored and quarantined for 14 days. Next slide. So what does this mean? It means, yes, you can take your mom out to lunch, but she may be quarantined for 14 days upon return. She may be asked or even required, though Sam will talk more about this in a few minutes, to take one or more tests to determine her COVID status. And in some cases, we have heard that facilities don't want to readmit residents who leave at all. They consider those residents gone and they try to discharge them. Next slide. So what can you do? Talk to the facility. Talk to them before your loved one leaves or you take them out. If you can get something in writing from them, even better, but at least have the conversation and see what they say. Understand their policies and requirements, and accept that the monitoring and quarantine and the testing may be being done for the safety of everyone in the facility. Once your mom leaves, or if another resident leaves, the facility has no idea where she's actually going to go, or if she's going to wear her mask, or if she's going to practice social distancing. They need to think about the safety of everyone else in the facility as well, and you would want them to do that for your own loved one. If you're not comfortable with what the facility's response is, involve your ombudsman. And here is where I'm going to ask Patty to chime in to see if she has anything to offer on either of these scenarios. If the facility won't let a resident use a common outdoor space, or what to do if a resident wants to leave a facility for a short time. Patty?
Hi, I'm going to say something about either of these and really all in the whole conversation today, and that is these are kind of lockdown scenarios that we really need to learn lessons from, and that's where I'm going to focus your attention to perhaps work with the Ombudsman program about how we're going to prepare for these situations in the future since COVID-19 will be back. And let's talk about how we can have the most sensible restrictions that are not isolating residents unnecessarily, and I will leave it there.
Okay, thank you very much. Next slide. So finally, let's talk about whether or not you can take your mom home for the duration of the pandemic. Yes, you can, but there's a lot to consider. There's a reason your mom or dad or loved one is living in a long-term care facility, and any choices you make need to bear that in mind. But the first thing to consider is your mom's own wishes. Does she want to leave? Remember, this is her home. This is where her life is. So involve her in the decision. Beyond that, recognize that she does have the right to live somewhere else. So talk with the facility. Importantly, maybe most importantly, ask if your mom can return after COVID. And this you want to get in writing. If her care is covered by Medicaid, ask what right she has for a bed hold and ask about her right to return. You also have to think about the environment you're bringing her into. Is your own home able to handle your mother's needs? Consider whether she needs a special bed or a wheelchair or other equipment, whether stairs will prevent her from moving around your house. You also need to think about her bathing, toileting, and eating. Is she going to need round-the-clock help with these activities? What about her transitions? Does she need to be lifted from a bed or a chair? Is this going to take more than one person? Next slide. If you can't provide for the level of care that she needs and you need outside help, are you able to pay for it? Also, considering our times, is there a risk of exposure to COVID-19 in your house? Is everyone practicing social distancing? Does your daughter work for Instacart or teach swimming lessons? What if she's out and about and gets infected? Can your family socially distance to the level necessary to protect a highly vulnerable person? Another consideration is your mother's medical care and medicines. Can you find a doctor in your community who can help navigate that? And what if your mother's needs change? What if she becomes more ill in your home and needs more care than you can provide? What if she needs to return to long-term care? Will she be able to go back to the facility she was living in during the pandemic? It's a lot to think about, and that's not to say it isn't the right decision for some families. For some families, it's exactly the right decision, but you need to figure out what works for you. We actually have a checklist that includes the questions above that's linked here in the slides. So if this is something you're thinking about, consider using that checklist before you make any decisions. Okay, that was a long topic. Luckily, the next one's gonna be a little bit shorter, so please keep watching. But the next topic is no less important. Next slide, please. We're going to talk about transparency. Basically, what your facility needs to be telling you, what you should be asking, and where you can find more information. Next slide. So first, your nursing home does have reporting requirements. CMS issued a new rule in May that specifically requires nursing homes to report on certain information. They are not able to leave you in the dark. There's information they are required to share with families, residents, and resident representatives. Nursing homes are required to tell families weekly or by 5 p.m. the day after an occurrence of a single confirmed infection of COVID or 3 or more residents or staff with new onset respiratory symptoms that occur within 72 hours of each other. That's a mouthful, but they need to either contact you when there's a confirmed infection or when 3 people all start displaying respiratory symptoms within a short period of time. They also have to tell you the actions that they're taking to mitigate the spread of the virus. And if none of that happens, they still need to contact you weekly and let you know. And the reporting needs to be cumulative, which we take to mean they need to let you know how many people have been sick. Now, obviously, this is not comprehensive information. It lets you know if there are current cases or suspected cases, but that's about it. The nursing home is also required to report to CMS at least weekly a lot more information. And all of the information that they report to CMS is public and available for you online. They need to report suspected and confirmed cases in residents and staff, total deaths and total deaths from COVID, the amount of PPE and hand hygiene supplies they have, their ventilator capacity, the amount of beds and residents that they have, their access to testing, and any staffing shortages they may be experiencing. Next slide, please. In addition to all of this, each individual state has been able to determine their own individual reporting requirements. Consumer Voice has a new map on our website, State COVID-19 Nursing Home Policies, that breaks down several different categories of information by state. One of them is reporting requirements. So you can visit that link and click on your state to see what your state's individual reporting requirements are. Next slide, please. So what should you be asking your facility? First, make sure that your nursing home is giving you the information they're required to share. And then ask them for more. Ask them for the information that they're sharing with CMS. It's public information. And just because it's not an actual requirement, there's no reason they can't give it to you. As a family member, you shouldn't have to go digging through CMS data to find out what's happening in your loved one's facility. Ask them for regular updates for you and other families. Ask them about staffing shortages, PPE, COVID deaths, and what you feel you need to get an accurate picture of what's happening. This is another great place to use both individual advocacy, but also to get your family council involved. All families should have this information. Next slide, please. That said, we know not everyone will get it easily, and we wanted to make sure you have the resources you need to find this information. So here you can find links. The information to CMS was made available starting in early June. You can visit their page and look up your facility in a variety of ways. They even have a countrywide map where you can zoom in and find your facility that way. And again, you can see the link to the state information on the Consumer Voice website. I also just want to mention something about the CMS data. There are a few problems with their reporting requirements that you may want to be aware of. Required reporting started at the end of May. That's when they needed to start looking and reporting their numbers. And this information went online at the beginning of this month, but facilities were given the option to include numbers starting on January 1st. This wasn't a mandate. Some facilities did and some didn't. In other words, some facilities are reporting on cases and deaths throughout the entire pandemic, and others are only reporting on cases and deaths that started in May. And when you look at the data, we don't know who did that and who didn't. So that's something to keep in mind. Also, not all facilities have reported. So bear that in mind too. And remember, this is a federal reporting requirement for nursing homes. Assisted livings are regulated at the state level, so they're not required to share this information with CMS. All of the advocacy we discussed earlier and all of the things I mentioned in this section about what you should ask of your facility applies equally to nursing homes and assisted livings. Ask your assisted living for this information. They may be required to share some things under state requirements, but either way, you should ask and advocate for them to share information with you. And with that, I'm going to turn things over to Sam to talk about testing.
Thank you, Jocelyn. So we have a couple minutes left, so I wanted to talk about testing. And before we get into this hypothetical, just wanted to let folks know that there is no federal mandate on testing of residents and staff. So essentially what is occurring now is states have developed their own policies, and it's a state-by-state situation where some states are requiring all residents and staff to be tested and others aren't. You can find that information on our website, as Jocelyn mentioned earlier. So we wanted to talk about a specific hypothetical around testing. And in this hypothetical, Mrs. Smith suffers from advanced dementia. She tends to become more distressed when the facility performs invasive procedures such as blood tests. The facility contacts her daughter, who is also her designated representative, and tells her that the facility will be testing all residents for COVID using a nasal swab. Daughter, representative, is gravely concerned that her mother will not tolerate this procedure and will cause her distress. She may not even have the test at all. Can the daughter, representative, refuse testing on Mrs. Smith's behalf? Next slide, please. First off, Mrs. Smith has a right to designate a representative who can exercise her rights. And right there we have the cites to the federal regulations. And the facility must treat the decisions of the representative as a decision of Mrs. Smith. And finally, Mrs. Smith, and therefore her representative, has the right to refuse treatment. In this instance, treatment is the COVID test. So yes, she could refuse treatment on behalf of her mother. And Mrs. Smith herself can refuse that treatment as well. Next slide. What do you do when the facility makes these requests? You can ask for an alternative form of testing. Is there a blood test? Again, this might not be right for Mrs. Smith, but is there another way that she could be tested that isn't so invasive and so distressful? One thing to be concerned about is if you do refuse testing, there could be a quarantine for 14 days. The idea being we don't know your status, so we're going to quarantine you, segregate you from the rest of the facility to determine whether you have any COVID symptoms. And the facility very well, not that it's legal, but they very well could threaten you with, or threaten Mrs. Smith or your loved one with discharge. Again, that's not legal, but it could happen. In that instance, we encourage you to contact the local ombudsman, also contact the state licensing agency to file a complaint. And that's a brief hypothetical on testing. I'm going to give it back to Robin.
Thank you so much, Sam and Patty and Jocelyn. Unfortunately, we've gone past 3:15 and don't have time for questions, but I hope you'll hang with us for just a couple more minutes. As you can see from the slides, we recommend that you also join with others in addition to contacting your state legislators, media, sharing your story. Joining with others in a group can be a wonderful way to channel frustrations and anger at these situations in a positive way that can make a difference. So look to see if you have advocacy groups in your state. You can check out this link to find out if there are any listed on our website. Consider AARP state chapters. Think about the ombudsman program. Patty mentioned that the ombudsman can work with family members who are interested and want to share their story and with legislators in a way that can make a difference, or sharing their story with others. So think about the ombudsman program. And of course, a shameless plug, please consider joining the Consumer Voice, and particularly joining our Action Network, which is free. You see the link there for signing up, but it's a way to keep up to date on the latest in policy issues and to communicate with lawmakers in a way that can make a difference, because we are concerned about the issues related to transfer discharge, to visitation, all those things. And we reach out through action alerts to folks in our network to have them join with us to communicate what changes need to be made to policymakers. Next slide, please. Just want to urge you to check out our information on our webpage. We have a webpage that's devoted just to COVID. You could see it here. We also have some resources that are particularly appropriate for the discussion we had today, including that checklist that Jocelyn had mentioned. Next slide, please. Unfortunately, we have to skip the next slide, but I just want to close by saying a big thank you to our presenters, Jocelyn, Sam, and Patty. I want to thank our, for lack of a better word, technical and logistical team, Libby Lauber, Tina Steyer, and Katie Kohler. And I want to thank all of you who are on today for everything that you do. And I just want to leave you with this message. Never give up. Advocacy isn't for sissies. It is hard work. And let's be honest, it can be really discouraging. But I want you all to know that you are not alone and that you are part of a vast network of advocates who, like you, care enormously about the lives and the well-being of nursing home residents. So just know that every time you speak out, even if you're not successful, and that happens to many of us a lot of the time, but every time you speak out, you send a message that poor nursing home care and treatment are not acceptable. And that message in and of itself is important. So thank you once again for all your advocacy, and be well and stay safe. So thank you, and that closes out our program.